Now in neurology, what you can get? Nothing to be scared much. Either you will get upper limb or lower limb, okay, or face for any nerves. So only these three things are coming, and always try to do all steps of examination of either upper limb or lower limb. Don't omit any step, okay, because they are separate marks for only examination, and your marks will be deducted. Even if you have come to the diagnosis, you have to do the all steps of examination so that you get full marks in your examination skill. And so when you will not omit any step, there are likely chances that you will not miss your diagnosis as well, because you will proceed in sequence from inspection, then examination, and then it's relevant whatever you need to proceed. Like in the upper limb, you have done all, and then you will upper limb, like if the most important thing first comes inspection. When you enter the room, just inspection is very important, okay. Please, you should spare 10 seconds for inspection. Your inspection should be very strong, and it can give you diagnosis even before touching the patient, believe me. And they are keeping some sort of things also related to the patient, some medicine, sometimes some drug chart, some patient orthosis, patient crutches, wheelchair, anything like that will give you a clue that patient is a sufferer of this disease, or this could be, okay. So when initially when you have greeted the patient and taken permission to examine, just tell him that what I will do, I will have a good look at you, okay. So now, what is meaning of good look? You will inspect deeply the patient and his surroundings, okay. uh, Give a look to the surroundings. So because examiners are observing you, they will give you marks for inspection, and also it will leave a good impression on them that that you are a very good doctor and very careful and vigilant and observant doctor. So, and you will mostly you find something related to the patient, okay. Like for example, in the Parkinson's, if there is Parkinson's disease, usually a command which is posted behind the patient is, okay, have a look at the patient and proceed. So when you will see the patient will be sitting, expressionless face, and his hands will be crossed, like he will not his hands will not be will not be he will not be keeping his hand freely in his lap. You will see, because in this way, if he'll keep freely and relaxedly, his tremors will be evident, and which they don't want you to show. So they want you to explore the tremors. So the patient's hand will be crossed, so tremors will be masked, and so you have to ask the patient, can you keep your hands in your lap? So, and the tremors will be evident. For Parkinson's disease, we know this is pill rolling resting tremor. So in this way you will get a clue. But this you all, like, see, if you are doing inspection, if you see a patient keeping the hands crossed, okay, so the Parkinson's disease should come into your mind, that it could be one of the possibility. Then if you see around the patient, if the like the limbs, if lower limbs, if they have asked you to examine, and it will be exposed, or if it is not exposed, you can tell the examiner that I need full exposure. So examine for any wasting, for any hypertrophy, for any scar mark, for anything, whatever you can get. This all on inspection I am telling you, okay. For any wound, that will or any ulcer that will show peripheral neuropathy, and if you see any wasting, the wasting means long-term disease. So if it's wasting of one lower limb or both lower limb, if it is a one lower limb, then mostly stroke it could be. And if it is stroke, one limb wasting, lower limb, then immediately you should have a look at the upper limb, and you will see that it will be pronate, in the pronated position. So like this, all you are doing on inspection within 10 seconds only, you have to correlate. Okay, first of all, see the on the patient you have seen, like one limb wasting, it could be stroke, see the upper limb, two limbs wasting. Okay, what else you need to see? It means it is long term disease. See any wheelchair around, any orthosis, any crutches, any other such thing, any splints around the patient, and see any hypertrophy of the limb. It could show that it could be Charcot-Marie. This is also most likely to come in the examination. Okay, and see if there is insulin pump hanging from the pent belt, then that could also indicate like Friedreich ataxia or multiple sclerosis, Friedreich ataxia, and or myasthenia gravis, or any autoimmune disease in which patient can have diabetes. And see the have a look at the face for any asymmetry, for any nerve palsy. Have a like facial nerve palsy, this Bell's palsy, this also commonly comes in the exam. Then have a look at the ears for any hearing aid, either it is cerebellopontine angle tumor, or it could be due to, again it can be due to Friedreich ataxia or cerebellopontine angle tumor. Both are the possibilities. And then see the eyes along with it, any nystagmus if you can observe. Then it could be young patient, if it could be due to multiple sclerosis, any cerebellar syndrome, any Friedreich ataxia, or any tumor, cerebellopontine angle tumor. Okay, and when you are greeting and you are shaking your hand with the patient initially, when you are introducing yourself, and when you have shaken the hand of the patient and patient does not leave your hand, then and you are trying to get rid of the patient hand and patient is not leaving, then immediately the myotonia dystrophica should come into your mind, because such patients, they have myotonia grip. So these poor patient, they are unable to leave or unable to relax their hands quickly. Okay, so this diagnosis immediately should come into your mind. Or while examining the patient face, you have to look for any ptosis as well. If it is there, then most likely it could be in the exam. There are many causes for the ptosis, but in your exam Paces, mainly three causes usually coming: myotonia dystrophica, myasthenia gravis, and third nerve palsy. Okay, and facial symmetry, as already I have described, for the seventh nerve palsy, Bell's palsy, you have to see. Okay, so there are different things relating to inspection. When I will cover each topic, I will tell you in detail. This I only give you a bird's eye view, that what you need to see if you get on inspection, and how quickly you have to correlate it with your diagnosis and with your differential diagnosis. Okay.
Please like, share and subscribe my YouTube channel for more videos. Thank you.